Welcome to Research Roundup by Integrated Benefits Institute, the podcast where we dive into the latest trends and research in the workplace health and productivity space. I'm your host, Dr. Sarah Lee Gurlau. Each episode, we will bring you the most recent studies, insightful analyses, and actionable takeaways to help you create a healthier, more productive workplace. Whether you're an employer, a benefits consultant, or a vendor, this podcast is designed to keep you informed and ahead of the curve. Let's get started. Our first article is a groundbreaking study from the Journal of Occupational and Organizational Psychology that tackles a timely and sensitive topic: reactions to diversity, equity, and inclusion statements, requirements in job applications. This research provides crucial insights into how different demographic groups perceive these increasingly common hiring practices. The findings are particularly noteworthy in today's polarized environment. White and politically conservative participants consistently viewed organizations requiring DE&I statements as less favorable, associating them with lower fairness and reduced job interest. What's especially interesting is that even attempts to justify or explain the purpose of DE&I statements did little to mitigate these negative reactions. The researchers looked deeper, finding that these negative perceptions often masked underlying racist attitudes, highlighting the complex intersection of personal beliefs, workplace practices, and organizational culture. This raises important questions about how organizations can effectively implement DE&I initiatives while managing potential resistance. The findings suggest that organizations need to think strategically about their DE&I practices, particularly in recruitment. While the research indicates the importance of maintaining DE&I initiative, it also points to the need for a more nuanced approach. Organizations might benefit from integrating these practices more seamlessly into their broader organizational culture and values, perhaps focusing on specific outcomes and benefits rather than standalone statements. Remarkable discoveries from our next study examining medical cannabis laws and their impact on employer-sponsored health insurance costs. This extensive research, spanning nearly 2 decades from 2003 to 2022, reveals unexpected economic benefits that could reshape how we think about healthcare costs. The findings are striking. States that adopted medical cannabis laws experienced significant decreases in average premium costs for both single and employee plus one coverage plans. But what's particularly fascinating is how these effects strengthened over time, suggesting a cumulative benefit rather than initial impact only. The researchers went further, calculating potential nationwide implications. They estimate that if all states had adopted medical cannabis laws by 2022, we could have seen billions in healthcare savings, potentially reducing healthcare's contribution to the GDP by 0.65%. This isn't just about direct cannabis users. The effects ripple through the entire healthcare system. The research points to potential significant cost-saving opportunities in states with medical cannabis laws. Organizations might want to monitor these trends closely, as they could substantially impact future healthcare benefit planning and costs. It might also influence decisions about where to locate offices and how to structure health benefits across different states. Our third study is an examination of financial behavior. Researchers have uncovered interesting links between income inequality and financial decision-making. This study, drawing from the Foundation's National Financial Capabilities Study, reveals patterns that challenge our understanding of how economic disparities influence personal financial choices. The results paint an intriguing picture. In areas with higher income inequality, people demonstrate greater overconfidence about their financial knowledge and showed increased willingness to take financial risks. Perhaps most surprisingly, this pattern is particularly pronounced among those with lower incomes, yet remains consistent across various age groups. The researchers suggest these behaviors might be a psychological response to status anxiety caused by an inequality, with individuals engaging in self-enhancement as a coping mechanism. This connection between social inequality and individual financial behavior has profound implications for workplace financial wellness programs. These findings reshape our understanding of financial wellness needs in high inequality areas. Organizations might consider developing more targeted financial education programs that address both practical skills and psychological aspects of financial decision-making, particularly in regions where income disparities are more pronounced. Turning to our next study on retirement security, powerful new data has emerged about hardship withdrawals among households with disabilities. This eye-opening analysis of the 2021 National Financial Capabilities Survey reveals troubling disparities that demand some attention. The numbers tell a stark story. Households with disabilities show a 6.37% higher probability of taking hardship withdrawals compared to those without disabilities. This gap widens even further for specific types of abilities. Seeing disabilities increase the probability by 7.04%, ambulatory disabilities by 7.57%, and multiple disabilities by a substantial 10.93%. Most remarkably, the researchers developed a prediction model that can accurately classify up to 85.4% of households with disabilities as likely to take a hardship withdrawal. This predictive capability opens new doors for targeted intervention and support. These insights call for a fundamental rethinking of how organizations structure their retirement benefits and financial support systems. Companies might consider implementing specialized financial counseling and creating more flexible retirement plan options that better accommodate the unique needs of employees with disabilities. Our fifth study looks at recent findings that have cast a spotlight on alarming disparities in workplace exposures across U.S. neighborhoods. This comprehensive analysis of occupational hazard indicators reveal patterns that challenge our assumptions about workplace safety and community health. The research uncovers a troubling reality. Census tracts with high percentages of both racial and ethnic minorities and low-income individuals face the highest exposures to noise, hazardous workplace conditions, and close physical proximity risks. Even more concerning, these high-exposure tracts show elevated rates of diabetes, asthma, and hypertension among racial and ethnic minorities, even after adjusting for social vulnerability factors. The researchers developed innovative place-based indicators that successfully identify communities with high occupational risks, communities often overlooked by current social vulnerability measures. This new approach provides a more complete picture of workplace health disparities. The findings call for a more nuanced approach to workplace safety and health equity. Employers should consider reassessing their occupational safety measures through an equity lens, ensuring adequate protection across all work environments and communities. Our final study, a comprehensive longitudinal study examining the pandemic's impact on different employee groups, provides fresh insight into the work-from-home experience. This 12-month investigation reveals surprising gender and parental status differences that challenge conventional wisdom about remote work. The data tells an unexpected story. Women reported 71% less family work conflict than men, a finding that contradicts many common assumptions about gender and remote work. However, the picture becomes more complex when considering parental status. Parents were over 8 times more likely to experience high levels of conflict and 3 times more likely to face moderate levels compared to non-parents. Yet, there is a silver lining. Parents were about 2.5 times more likely to see their conflict levels decrease from high to moderate over time, suggesting an adaptation to remote work arrangements. This evolution in work-family dynamic offers valuable insights for future workforce planning. These findings suggest the need for a more nuanced approach to remote work policies. Rather than a one-size-fits-all solution, organizations might benefit from developing flexible arrangements that account for the varying experiences of different employee groups, particularly considering gender and parental status. For more information and links to these journal articles, be sure to visit our website, www.ibiweb.org, and head over to our monthly research reviews section. That wraps up this episode of Research Roundup by Integrated Benefits Institute. We hope you found the insights valuable and the research thought-provoking. If you enjoyed today's episode, please subscribe to our podcast and leave us a review. Your feedback helps us to improve and bring you the content you need. Don't forget to share this podcast with your colleagues and network. Join us next time as we continue to explore the latest trends and research in employee health and well-being and workplace productivity. Until then, stay curious and keep learning.